We are in the midst of an overdose crisis, which requires immediate action. Today, I'm proposing a 3-point emergency action plan. The first action the UCP should take is to urgently expand supervised consumption services, not just in Edmonton and Calgary, but in communities across Alberta. The evidence from our existing sites is absolutely conclusive. No Albertan ever died of an overdose at a supervised consumption site. They keep people alive. And they create connections to the healthcare system, making it more likely that service users will have access to the supports that they need. The government must scrap its plans to close existing sites and make immediate plans to expand these services. I also call on Jason Luan to scrap his idea of requiring people to produce an Alberta healthcare number to use these services. There may be some data tracking use for this, but that benefit is completely outweighed by the fact that many people will simply not go if they know they'll be required to identify themselves. The second action is to provide safe, legal, and regulated pharmaceutical alternatives to Albertans who are using highly toxic street drugs. This saves lives, it reduces crime, and it helps build a relationship between Albertans using substances and a healthcare professional. And third, the province should help provide drug checking services. Quite simply, a test to see if street drugs are lethally toxic. This is being done at a few different places across the country, including British Columbia and Manitoba. It should also be available here in Alberta.
There have been more fatal overdoses in the downtown core of Edmonton since the recent closure of the supervised consumption site at Boyle Street Community Services and the closure of Arches SCS in Lethbridge last fall. Supervised consumption sites such as the one in Calgary must be kept open or be reopened, and more sites can be opened in Alberta. Supervised consumption sites are a public good. In other parts of our country, people who are dependent on opioids are prescribed pharmaceutical hydromorphone. Our government can also access funds from the federal government for safe supply. Patients in Alberta with problematic substance use can be prescribed pharmaceutical alternatives to dangerous street fentanyl. Safe supply is a public good. Addiction is defined as continued use despite consequences. So if we don't want the consequence of drug use to be death, I implore the UCP government to work with the NDP to implement the recommendations that are being made today in honor of our loved ones.